When I found out that there was a heart available for my son, I said a prayer for the other family. That was the first thing I did because they just gave the most loving gift.
When they get the news that their kids are going to need a transplant, I mean, your world just crumbles. I mean, the kid should not need a heart transplant.
I was scared, I was angry. I thought that they could keep fixing his heart, and that's just not an option sometimes.
Somewhere between 1 and 10 out of every 100 children has a heart condition. Clearly, it's the most common defect that children are born with.
250 surgeries a year, or now 500 plus surgeries a year. And that's a large program, nationwide and worldwide. Having a large program affords for you to be able to have a top-notch transplant program, a top-notch artificial heart program, imaging program, genetics, neurodevelopment, rehabilitation program.
I could tell that something was wrong, like wrong with something in me. I thought it was my appendix.
That's when they told me, your son's having chronic heart failure. And I just was like, what, I didn't even know what to think.
It's a doozy for a teenager, who was hiking the mountains, 1 month, and all of a sudden he's got, somebody else's heart inside of him. Having to take medicines, sometimes 10, 15 medicines, 3, 4 times a day. You have to go to the hospital all the time. You have to, live in a bubble for a little while, while you're on so many medications.
Can't help out around the house. Can't go to church. Can't go to school.
His life is 100% different. And now everything has to be thought about. Everything has to be purposeful. You can't just react, which is hard for a 14-year-old boy.
Some of the questions we have regarding children is how do they respond to a critical illness. So there's some behavioral issues we'd like to evaluate. We have a number of devices that we use to help support the children when their heart is failing, and so we'd like to uncover what are the optimal devices that can be used to support a child. Research
within the Heart Center at Phoenix Children's Hospital can make a big difference in diagnosing incredibly complex disease, modeling it, and even doing virtual surgery, where we can train young surgeons on how to do surgery on complex heart problems.
We have some interest in tissue engineering. Many times we have to reconstruct portions of the heart. And we would really like to find out more about what are the best tissues to use for that type of reconstruction.
A cardiogenetics program would allow for us to have earlier diagnosis and potentially make a difference much earlier, be it in the womb or in the first hours of life.
These areas are all areas of high need and significant interest to the entire field of congenital heart care.
With a kid, you see life, in front of them. I mean, you can see or imagine them doing or being whatever they want to do.
This hospital absolutely saved my son's life.